I'll table the advice from the experts. This is the Canadian Mental Health Association's report that was released today, Madam Speaker. It's disappointing to hear the Premier set out the standard of downtown Eastside Vancouver as what we should expect to see before they will take action to actually save lives. It's right there in black and white in the CMHA report today. Safe consumption sites save lives. The very same report. The very same report says that safe consumption sites actually help to reduce fatalities in private homes. The reason being that currently people have to use in private homes because there are no areas where they can do so with medical supervision. If those safe consumption sites provided an avenue where people could use and then be referred to treatment or potentially medical care, it will save lives in our province. Will the Premier reverse course and instead support the application to have a safe consumption site right here in Winnipeg?
No, Madam Speaker. As opposed to the previous administration, we'll commission the advice of experts. We have done so. We await the recommendations. We'll act on those.
Madam Speaker, there is a consensus amongst experts, amongst those who study harm reduction, that safe consumption sites save lives. It's right there in black and white in the report that I just tabled in front of the Premier. Safe consumption sites save lives. We know that lives are being lost to overdoses in our province, but there is also a real issue with the lives that are being ruined by addictions. Safe consumption sites offer the opportunity for people to have an on-ramp into addictions treatment. If they can use in a facility where they have access to medical help, then potentially they could also receive a referral to treatment. The expert consensus is clear. Why doesn't the Premier get on board, support Main Street Project's application to have a safe consumption site right here in the city of Winnipeg?
Speaker, because I don't accept the premise of expertise on the part of the member.
Thanks, Madam Speaker. He doesn't need to rely on any expertise on my part. He can look to the Canadian Mental Health Association. Were that not enough, I know that there were people who were here in the gallery today who are combating this opioid epidemic on the front lines. And when I talked to them, they said, yeah, it's time for a safe consumption site. What's more, when I attended the town hall on methamphetamines hosted by my colleagues from Point Douglas and from St. John's, I listened very closely what the Chief of Police, Danny Smythe, said. And in his comments there, he said, yes, it's time for Winnipeg to start talking about having a safe consumption sites. So again, this is not my pet project. This is bringing forward the recommendations of experts, bringing forward the recommendations of those in the community, bringing forward insight gleaned from the Chief of Police of Winnipeg. When will the Premier reverse course and support an application for a safe consumption site right here in Winnipeg?